Good morning children. Today in this video we will discuss about what is behavior therapy and what are the techniques that are used by the therapist to deal with the individual's problem. So children, let me tell you, the behavior therapy states that psychological disorders arises due to maladaptive or faulty learning when an individual adapts the bad habits by either observing other person, and this may result a person to suffer from behavior disorders as well as psychological disorders. So children, behavior therapy consists of a large set of specific techniques and intervention, and on the other hand it is not a unified theory which is applied irrespective of the clinical diagnosis or the symptom present. So children, it means the mode of treatment when a person suffers from a different behavior problems is different from one another. So children, it is believed that the people who suffer from phobias, the mode of treatment is different as compared to the person who suffer from maladaptive behavior, the mode of treatment is different. So children, let us know about the major objective of the behavior therapy, which states that behavior therapy is a mode of treatment for a problem in which a trained person deliberately establishes a professional relationship with the patient with the objective of removing or modifying existing symptoms and promoting personality growth and development. So children, the main of behavior therapy is to promote the optimal growth and development in individuals and to eradicate the negative pattern of behavior. Behavior therapy is used to help client acquire new coping skills, improve communication, or to learn or break maladaptive habits and overcome self-defeating emotional conflict. A person might have emotional conflict due to not having good environment at home. A reason could be many. Behavior therapist or a counselor focuses on interpreting the client's behavior. So the main aim of therapist or the counselor is to know about the client behavior, emphasizing a collaborative and positive relationship with the client, and values the use of objectivity to assess and understand the client. So children, it means the therapist builds the trust with the client so that client is comfortable to share his or her problem. So children, once the faulty behavior which caused distress have been identified, a treatment package is chosen by the therapist. The major aim of the treatment is to eliminate the faulty behaviors and substitute them with the adaptive behavior pattern. So the major job lies with the therapist. So the different methods that are used by the therapist, it includes different types of techniques. So children, it comprises of negative reinforcement, aversive conditioning, positive reinforcement, token economy, and systematic desensitization. So children, the major principle of these techniques are to reduce the arousal level of the client, alter or change the behavior through classical or operant conditioning. So children, as we have studied earlier also, reinforcement is used either to increase the probability of the wanted behavior, which comprises of negative reinforcement and positive reinforcement. So children, positive reinforcement has the pleasant consequence on the individuals. For example, when child does something good, we praise him either by a reward. Reward could be given in the form of toffee or anything. On the other hand, talking about the negative reinforcement, it has the negative painful experiences for an individual when we make use of the negative reinforcement. So children, negative reinforcement is given so that person does not acquire those habits which are not appropriate. So person might be given an electric shock. So children one learns to move away from dangerous stimuli because they provide negative reinforcement. Now children, talking about aversive conditioning. In aversive conditioning, repeated association of undesired response with an aversive consequence. For example, an alcoholic is given a mild electric shock and asked to smell the alcohol. With repeated pairing, the smell of alcohol is aversive. As the pain of the shock is associated with it, the person will give up alcohol. So children, by giving this aversive conditioning, even if the individuals start to take up the alcohol again, he would remember the shock which was given on taking of the stimulant such as alcohol. So this is known as aversive conditioning. Now children, talking about positive reinforcement, this could be understood with a simple example. If a child does not do homework regularly, a positive reinforcement may be used by child mother by preparing the child's favorite dish whenever he or she does not do the homework regularly. So use of positive reinforcement can be used. On the other hand, token economy can be used whenever a person displays the wanted behavior, such as taking a person for an outing or rewarding a person either toffee, chocolates. This would motivate the individual to show the wanted behavior. So children, wanted behavior means a behavior which is appropriate, which is good. Now children, talking about systematic desensitization. This method was developed by Wolf for treating phobias and irrational fears. The client is interviewed to elect the fear-provoking situation, and together with the client, the therapist prepares a hierarchy of anxiety-provoking stimuli with the least provoking stimuli. At the bottom of the hierarchy, the therapist relaxes the client and asks the client to think about the least anxiety-provoking situations. In a relaxation manner, the client is asked to stop thinking of the fearful situation. If the slightest tension is felt over the session, the client is able to imagine more severe fear-provoking situation while maintaining the relaxation. So the client gets systematically desensitized to the fear. So by preparing a hierarchy, the therapist come to know about the stressful situation which affects an individual to suffer from the phobia or irrational fear. So children, as I have discussed about the different types of techniques which are used in behavior therapies, kindly make a note of this.